her, and we're using, much more difficult to do this, but we're trying. We're doing a curved cannula to give her the hip tips improvement that she's looking for. This is using her own fat, stem cells, and PRP to this area. But look at that contour. You guys could see it here. So this is going to finalize, that's half, the improvement that we were looking for regarding her hip. We're going to be doing more in the back, but I'm trying to get from the front, because we have to do this curved cannula, it's a much smaller exit. It's a lot harder to do, even with all my strength. So I'm going to try my best. There we go. To get this to go so that I can, there we go, get an even better improvement, because this will get her the hip dip improvement she wanted even more. See, like right off the bat, it's shaping this outer thigh to the contour that she was looking for. We're giving her more, an increased hip to waist ratio, so she looks slimmer. All right, so then look, we're going below where we contoured already to give her the shaping, and we're balancing that to her outer thigh. That looks really good. So you see how it's coming in here, going out there. That's 2.5 on this side. And you see we're building these out. Look how small her waist looks. What are people saying? Anything?
One person says hi.
Hey. I think it's the same person. They keep saying, I feel like they have a bot on there just to say hello. But this is something where if you're going to get this done, you want to have the most purified fat in this area, because we want the fat to survive, and you don't want to waste your fat. Okay, so that's 2.5. So let's go to the other side now. And we want to contour this the way that she really wanted, which was to give her more of that rounder shape, matching more her outer thigh, so she doesn't have as much of a dip. So there's a little bit more here I need to do. It's okay. A little bit more we need to do. We purified this. It's called our fusion. This is fat plus stem cells, PRP, exosomes, and peptides. And hold on.
Someone said, "Sir, I am from India. Is there a doctor like you in India?"
No, that's the problem. You can come see us in New York if it's harder for you to travel as far. It's easier, usually. That one didn't go. We're almost there. We got to do at least one more per side. But given that she has a more fibrous fat, and it's a really small exit for this curve, it just takes a little bit more work. But that's okay. We'll get there. We'll keep transferring. All right. So, again, trying to get this fat into the right positioning. Okay, that's half. Again, now look, the hip dip's being filled out, which is exactly what she wants on the front. That's half. I need another half. And look how thin this is here. So what do you think people would want to know with regards to fat grafting? What do they typically like to ask? Well, people want to know how much will survive. If you do the PRP, A-cell, anti-age exosomes, yeah, real close, and you do our BioRain with fusion, the chance of survival is much higher. Also, if you do hyperbaric oxygen therapy post-treatment, it helps it survive because this needs blood supply. And if you, there we go, good. That looks really good. I think we're almost there. Okay, so that's now 3.5. Let me do another one on the other side. And if you do massages, I think that's actually good. One more. 3.5. if I need another half here. So hyperbaric oxygen therapy, IVs, and massages. Also taking systemic peptides and things that increase your circulation, like daily Cialis and exercise. You could even take PT-141 peptide. That also can help stimulate circulation. Perfect, there we go. Okay, that side's good for now. That's done. Yeah. I want to get the entrance out. So I think that's a lot better from the front. We can get the rest from the back. We just got to do a little bit more up there to give her more of that roundedness up top. A bit through here. And then we'll finalize this. All this discoloration is normal. That's the blood supply coming back after the epinephrine has worn off a little bit. And you'll see even tomorrow, she'll almost have no bruising. Here we go. Even? 4.5?
4.5.
Yeah. We could do, if you get another half, we could do another half each. We'll make it 5. We're going to try. So this is the look. Bringing this in around the breast, tightening the sides, bringing it in here, giving her that subtle improvement in the contour that she was looking for. And then coming out, some people call this an S curve, see? Like this. So I'll show you the final result in a second once we get some of these fibers out. The healing from this is 1 to 2 weeks of aftercare, and then another 1 to 2 weeks of resting with compression. You do not have to restrict yourself from staying home except for the first couple days. After that, good. Now, this should be good. Perfect. Okay, that's it.
Is it?
What did we do? 4.5?
You did about, no, that's for about 4.5 each.
Okay, that's perfect.
This would be 5 and 5.
That's okay. This 4.5 is good.
4.5?
So now if you guys look from the front on the top, if you can, you could show her them here. Like come flat like this. Good. You could see the curve and you could see the hips. And now she has the definition she wants, tightening all throughout and a more roundedness in her hip. We'll finish it all from on the back side, guys. Take care.